I'm coming towards the end of my 4th year of registrar training, so I've worked in quite a few units around the country, both in the West Mids and Central London and in the South East, so Essex, Kent and Sussex. I've worked through various surgical specialties as well as medical specialties. And what I've been particularly impressed with on this ward is the safety of the patients, which is always paramount, and how well they're managed, but also the efficiency with which the nursing staff and the team as a whole deal with the high turnover of patients here.
Kent ward is a vascular ward. Our patients at times can be very poorly and very frail. And obviously we always try to sort of give the best care that we can. Our patients are at high risk of falls, and also because they have a lot of wounds, we have to be very careful they don't get wound infections. So we just try and, nurse them to the best of our capabilities.
Examples, MRSA rates are very low in the ward. 100% of all elective patients are screened for MRSA before they get to the ward, which I think is amazing. In the 6 months I've been here, I haven't seen a single case of C. diff, and we use a lot of antibiotics for our patients, and we use large numbers of different types of antibiotics in the same patients, so they're at high risk of acquiring C. diff infections, for example. The use of high-low beds for our high-risk falls patients, the fact that at least 2 of the bays can be seen from the desk.
They work so hard every single day. Their care is always patient-focused. They've got very strong commitment to all their patients, and they always deliver a high quality of safe care.
Stroke disease has had a huge paradigm shift with regards to our treatment modalities. In the last 5 years, we've been able to break down the clots within patients' brains to reperfuse that part of the brain that was suffering and allow them to survive, but also to have a better function. Unfortunately, we've been unable to treat those patients when we hadn't known what time their symptoms started, and that's because there's a great risk with this treatment of bleeding within the brain. We've used novel imaging techniques, in this case CT perfusion techniques, to work out which parts of the brain are amenable to this new treatment. It's one of the first examples in the country, and we've demonstrated a really quite remarkable reduction in both mortality and also functional disability. The service has been operational since September 2010, and up to date now we've treated over 80 patients successfully. The mortality, the chance of death untreated, was approaching a third, 29%. With the introduction of this new imaging technique and treatment, the mortality has fallen down to 4%. 90% of patients that survived their stroke would end up institutionalised in a residential or nursing home. Now those patients that survive, a third of them are ending up with an institutional level of care. 2/3 go home. So a significant reduction in chance of death, but also functional disability.
The DVD is an opportunity for patients to understand in advance of their procedure being undertaken what's involved, and I'm really pleased that we've managed to put ourselves in the shoes of a patient in creating what's an exemplary DVD.
There's a sister on your shoulder giving you reassuring words, and the lights were dimmed and there's music playing, and it made you feel comfortable.
I was quite excited and telling everybody about it and how well it went, because everybody knew I was nervous before I went, and it just worked out so well.
I'm really pleased that we've developed a DVD product which is based upon real patient experience, and patients have inputted, along with Gemma, Anita and Alison, in developing a DVD product which places them at the heart of the service that we now provide.